the idea for a primary combination therapy with a gliptin, in that case vildagliptin, and metformin, really came from the notion that monotherapy doesn't do the trick in our patients, certainly not for long enough and not in a durable way. Guidelines suggest to wait and see, and if things go off, only then add a second drug. We had the idea that might as well do it right at the beginning, diagnosis, a few checkups here and there, and start with a primary combination therapy, see if this carries the patient longer, ideally for many, many years in the good glycemic range. The population of Verify has been really hand-selected in a way. We are completely away from the big intervention studies that we're seeing now, because those are mainly designed to pick up a hard endpoint signal. So it required an advanced stage of diabetes, ideally some pre-existing cardiovascular disease, to increase the likelihood for an event like a myocardial infarction within the 5 to 7 year study period. And this is not where we were at, because our hypothesis was do something very early in a very smart way as to prevent those late complications of diabetes rather than reducing the number of events. So our population is relatively young, very early in their disease progression. On average, it's less than half a year after diagnosis has been made. Plus, our patients still have an HbA1c almost normal, only a little above where you'd say, that's an okay type of HbA1c, while most other studies really have HbA1cs of 8, 8.5, 9s. So comparable, only adopt in a way, and UKPDS, but there's an ancient study, so things are quite different. So it's really uncharted territory. The aim was really very simple. The design of Verify is a little more complicated. The aim was to decide to really produce hard data that allowed us to decide whether it works, primary combination, whether primary combination is better than monotherapy. For the design, it made it necessary to have escape and switch over mechanisms that were a little complicated to analyze, but we did quite well. So it was essentially a 3-period study. The first was a straight metformin plus placebo versus metformin plus vildagliptin. And once people failed, as they normally do at some stage, could be after 6 months, could be after 24 months, something would happen and they would enter some switch of regimen, enter a new period, and the analysis would take care of it. That way we could people in a reasonable range for the entire duration. We had no idea how far they would get off, and at some point it's not ethically allowed anymore to continue at very high HbA1c ranges. So 2 arms with escalation procedures and counting of failure defined as HbA1c above 7. Safety-wise, to begin with, was no signal and none of the perhaps expected side effects such as hypoglycemia or liver function tests have been connected with vildagliptin. So no signal for any of the side effects. Efficacy, in a way, was the time to failure with the combination therapy. Time to first failure, that was nearly double in the combination arm versus the monotherapy arm. Then people went on to the second period, and we would assess time to second failure. And that again was significantly different. It was 25% reduced in those who had previously been on monotherapy only. So in other words, there was a memory, a legacy for the original combination therapy that lasted even through that second period, where people would then receive both drugs. So a first direct result of what we expected, and then a somewhat unexpected result that it would last longer than people actually stayed in the original arm. Well, in theory, we now have evidence to start immediately after the diagnosis has been made with a combination therapy of a gliptin and metformin. It's unclear whether other gliptins would do the same, could do, but need not necessarily. So vilda plus metformin, to me, and actually to many clinicians already, is a primary treatment regimen, rather than wait for half a year or a year before you start the second. The guidelines suggest you wait. We suggest to change the guidelines based on this data and put people immediately on combo.